The body changes with aging because changes occur in individual cells and in whole organs. These changes result in changes in function and in appearance. See also Overview of aging. As cells age, they function less well. Eventually, old cells must die, which is a normal part of the body's functioning. Old cells sometimes die because they are programmed to do so. The genes of cells program a process that, when triggered, results in death of the cell. This programmed death, called apoptosis, is a kind of cell suicide. The aging of a cell is one trigger. Old cells must die to make room for new cells. Other triggers include an excess number of cells and possibly damage to a cell. Old cells also die because they can divide only a limited number of times. This limit is programmed by genes. When a cell can no longer divide, it grows larger, exists for a while, then dies. The mechanism that limits cell division involves a structure called a telomere. Telomeres are used to move the cell's genetic material in preparation for cell division. Every time a cell divides, the telomeres shorten a bit. Eventually, the telomeres become so short that the cell can no longer divide. When a cell stops dividing, it is called senescence. Sometimes damage to a cell directly causes its death. Cells may be damaged by harmful substances, such as radiation, sunlight, and chemotherapy medications. Cells may also be damaged by certain byproducts of their own normal activities. These byproducts, called free radicals, are given off when cells produce energy. Disorders, not aging, usually account for most loss of function. How well organs function depends on how well the cells within them function. Older cells function less well. Also, in some organs, cells die and are not replaced, so the number of cells decreases. The number of cells in the testes, ovaries, liver, and kidneys decreases markedly as the body ages. When the number of cells becomes too low, an organ cannot function normally. Thus, most organs function less well as people age. However, not all organs lose a large number of cells. The brain is one example. Healthy older adults do not lose many brain cells. Substantial losses occur mainly in people who have had a stroke or who have a disorder that causes the progressive loss of nerve cells, neurodegenerative disorders, such as Alzheimer's disease or Parkinson's disease. Often, the first signs of aging involve the musculoskeletal system. The eyes, followed by the ears, begin to change early in midlife. Most internal functions also decline with aging. Most bodily functions peak shortly before age 30 and then begin a gradual but continuous decline. However, even with this decline, most functions remain adequate because most organs start with considerably more functional capacity than the body needs, functional reserve. For example, if half the liver is destroyed, the remaining tissue is more than enough to maintain normal function. Thus, disorders, rather than normal aging, usually account for most of the loss of function in older age. Even though most functions remain adequate, the decline in function means that older adults are less able to handle various stresses, including strenuous physical activity, extreme temperature changes in the environment, and disorders. This decline also means that older adults are more likely to experience side effects from medications. Some organs are more likely to malfunction under stress than others. These organs include the heart and blood vessels, the urinary organs, such as the kidneys, and the brain. Bones and joints. See also effects of aging on the musculoskeletal system. Bones tend to become less dense. Moderate loss of bone density is called osteopenia, and severe loss of bone density, including occurrence of a fracture due to loss of bone density, is called osteoporosis. With osteoporosis, bones become weaker and more likely to break. In women, loss of bone density speeds up after menopause because less estrogen is produced. Estrogen helps prevent too much bone from being broken down during the body's normal process of forming, breaking down, and reforming bone. Bones become less dense, partly because they contain less calcium, which gives bones strength. The amount of calcium decreases because the body absorbs less calcium from foods. Also, levels of vitamin D, which helps the body use calcium, decrease slightly. Certain bones are weakened more than others. Those most affected include the end of the thigh bone, femur, at the hip, the ends of the arm bones, radius and ulna, at the wrist, and the bones of the spine, vertebrae. Changes in vertebrae at the top of the spine cause the head to tip forward, compressing the throat. As a result, swallowing is more difficult, and choking is more likely. The vertebrae become less dense, and the cushions of tissue, discs, between them lose fluid and become thinner, making the spine shorter. Thus, older adults become shorter. The cartilage that lines the joints tends to thin, partly because of the wear and tear of years of movement. The surfaces of a joint may not slide over each other as well as they used to, and the joint may be slightly more susceptible to injury. Damage to the cartilage due to lifelong use of joints or repeated injury often leads to osteoarthritis, which is one of the most common disorders of later life. Ligaments, which bind joints together, and tendons, which bind muscle to bone, tend to become less elastic, making joints feel tight or stiff. These tissues also weaken. Thus, most people become less flexible. Ligaments and tendons tend to tear more easily, and when they tear, they heal more slowly. These changes occur because the cells that maintain ligaments and tendons become less active. Muscles and body fat. The amount of muscle tissue, muscle mass, and muscle strength tend to decrease beginning around age 30 and continuing throughout life. Some of the decrease is caused by physical inactivity and decreasing levels of growth hormone and testosterone, which stimulate muscle development. Also, muscles cannot contract as quickly because more fast-contracting, fast-twitch muscle fibers are lost than slow-contracting, slow-twitch muscle fibers. However, aging's effects reduce muscle mass and strength by no more than about 10 to 15% during an adult's lifetime. In the absence of disease, most of the loss beyond that 10 to 15% is preventable with regular exercise. More severe muscle loss, called sarcopenia, which literally means loss of flesh, results from disease or extreme inactivity, not from aging alone. Most older adults retain enough muscle mass and strength for all typical necessary tasks. Many older adults remain strong athletes. They compete in sports and enjoy vigorous physical activity. However, even the fittest notice some decline as they age. To make up for the muscle mass lost during each day of strict bed rest, older adult may need to exercise for up to 2 weeks. Regular exercise to strengthen muscles, resistance training, can partially overcome or significantly delay loss of muscle mass and strength. In muscle strengthening exercise, muscles contract against resistance provided by gravity, as in sit-ups or push-ups, weights, or elastic bands. If this type of exercise is done regularly, even people who have never exercised can increase muscle mass and strength. Conversely, physical inactivity, especially bed rest during an illness, can greatly accelerate the loss. During periods of inactivity, older adults lose muscle mass and strength much more quickly than younger people do. For example, to make up for the muscle mass lost during each day of strict bed rest, people may need to exercise for up to 2 weeks. By age 75, the percentage of body fat typically doubles compared with what it was during young adulthood. Too much body fat can increase the risk of health problems, such as diabetes. The distribution of fat also changes, changing the shape of the torso. A healthy diet and regular exercise can help older adults minimize increases in body fat. Eyes. See also effects of aging on the eyes. As people age, the following occur. The lens stiffens, making focusing on close objects harder. The lens becomes denser, making seeing in dim light harder. The pupil reacts more slowly to changes in light. The lens yellows, changing the way colors are perceived and causes loss of contrast perception. The number of nerve cells decrease, impairing depth perception. The eyes produce less fluid, making them feel dry. A change in vision is often the first undeniable sign of aging. Changes in the lenses of the eye can cause or contribute to the following: loss of near vision. During their 40s, most people notice that seeing objects closer than 2 feet becomes difficult. This change in vision, called presbyopia, occurs because the lens in the eye stiffens. Normally, the lens changes its shape to help the eye focus. A stiffer lens makes focusing on close objects harder. Ultimately, almost everyone gets presbyopia and needs magnifying reading glasses. People who need glasses to see distant objects may need to wear bifocals or glasses with variable focus lenses. Need for brighter light. As people continue to age, seeing in dim light becomes more difficult because the lens tends to become less transparent. A denser lens means that less light passes through to the retina at the back of the eye. Also, the retina, which contains the cells that sense light, becomes less sensitive. So for reading, brighter light is needed. On average, 60-year-olds need 3 times more light to read than 20-year-olds. Changes in color perception. Colors are perceived differently, partly because the lens tends to yellow with aging. Colors may look less bright, and contrasts between different colors may be more difficult to see. Blues may look more gray, and blue print or background may look washed out. These changes are insignificant for most people. However, older adults may have trouble reading black letters printed on a blue background or reading blue letters. The pupil of the eye reacts more slowly to changes in light. The pupil widens and narrows to let more or less light in, depending on the brightness of the surroundings. A slow reacting pupil means that older adults may be unable to see when they first enter a dark room, or they may be temporarily blinded when they enter a brightly lit area. Older adults may also become more sensitive to glare. However, increased sensitivity to glare is often due to darkened areas in the lens or to cataracts. Most 60-year-olds need 3 times more light to read than 20-year-olds. Fine details, including differences in shades and tones, become more difficult to discern. The reason is probably a decrease in the number of nerve cells that transmit visual signals from the eyes to the brain. This change affects the way depth is perceived, and judging distances becomes more difficult. Older adults may see more tiny black specks moving across their field of vision. These specks, called floaters, are bits of normal fluid in the eye that have solidified. Floaters do not significantly interfere with vision. Unless they suddenly increase in number, they are not a cause for concern. The eyes tend to become dry. This change occurs because the number of cells that produce fluids to lubricate the eyes decreases. Tear production may decrease. The appearance of the eyes changes in several ways. The whites, sclera, of the eyes may turn slightly yellow or brown. This change results from many years of exposure to ultraviolet light, wind, and dust. Random splotches of color may appear in the whites of the eyes, particularly in people with a dark complexion. A gray-white ring, arcus senilis, may appear on the surface of the eye. The ring is made of calcium and cholesterol salts. It does not affect vision. The lower eyelid may hang away from the eyeball because the muscles around the eye weaken and the tendons stretch. This condition, called ectropion, may interfere with lubricating the eyeball and contribute to dry eyes. The eye may appear to sink into the head because the amount of fat around the eye decreases. The eyebrows drop down lower. Ears. See also effects of aging on the ears, nose, and throat. Most changes in hearing are probably due as much to a lifetime of noise exposure as to aging. See also hearing loss. Exposure to loud noise over time damages the ear's ability to hear.